Hi, my name is Jordan,
Hi, my name is Ashley.
and we are doing PTSD.
Mm.
I will be doing the introduction of PTSD, the history of it, the common causes and symptoms of it, the statistical facts, and treatments regarding how to manage PTSD. And Ashley will be doing
I'll be doing main interesting facts about PTSD, how it affects society, a conclusion, and then along with any like future developments for PTSD.
PTSD. Many people in our society experience some level of trauma events that leads them to suffer with symptoms of PTSD. Thus, PTSD is a mental disorder that occurs in individuals who experience a trauma event that impacts their daily life functioning. What is the history of PTSD? PTSD originated in the 19th century in American soldiers and civilians who witnessed catastrophe events like the railroad collision, traumatic events of the World War One and Two, and in World War One, they would label it as shell shock when one resembles symptoms of PTSD. Thus, through these different wars, the soldiers would showcase similar symptoms of PTSD, but they would be misdiagnosed with exhaustion or heart conditions called irritable hearts or similar symptoms of PTSD. It wasn't until the Vietnamese War that led researchers to study the causes of PTSD because of the compact fatigue the veterans were showing of suffering psychologically in their social and work life. This led the National Vietnamese Veterans Readjustment Survey to be the first study to study PTSD and combat psychological issues in veterans. Their findings let PTSD be recognized as a disorder, redefine the symptoms, and diagnosis for it in our modern society. Thus, the basic symptoms and common causes of PTSD. There are four symptoms of PTSD. One is intrusion, avoidance, change in mood and thinking, change in one actions, and arousal. Example intrusion is having intrusive thoughts that are repetitive, like nightmares or flashbacks of that traumatic event. Avoidance is when people are avoiding places or people or things that remind them of that traumatic event. They also have change in mood and thinking, which means they'll have a fearful reaction or horror or stop doing things that they once used to enjoy. And for changing one action arousal, example of that is being more angry, having angry outbursts, reckless behavior. Thus, these symptoms must be 1 to more months for it to be considered PTSD. A common cause of PTSD is imbalance of neurotransmitters levels and hormone changes due to being exposed to these traumatic events. In PTSD, the corticotrophin releasing factor is triggered, which releases the neurotransmitter of norepinephrine, which then influences the response of the sympathetic nervous system of fight or flight. Individuals who have PTSD, their fight or flight state is constantly being overacted because of these triggers that reminds them of that traumatic event. For the statistic fact, how common PTSD is in adults and genders are recent articles from the U.S. Department of Veteran Affairs have showed that 6 out of 100 people will experience PTSD in some part in their life. 5 out of 100 adults in the US have PTSD every year. Women are 6% more prone to develop PTSD because they experience more traumatic events of sexual assault than men. However, men are 4% more inclined to develop PTSD some part of their life. Thus, what is the treatment of PTSD? There are different types of treatments for PTSD, like the main one is cognitive behavioral therapy is a form of psychotherapy, which basically means talk therapy, is which involves having a licensed training a mental health professional like a psychologist, psychiatrist. And through this therapy, the therapists provide the families and the individuals who experience PTSD's guidance, support, and education how to help them have a better functioning life with PTSD. There's other forms of treatment for other than this type of treatment, like processing therapy, group therapy, prolonged exposure therapy, and that concludes the treatments.
Okay. So now onto my slides. This is going to be starting for the future for PTSD. The National Institute of Mental Health stepped closer into bringing awareness for PTSD patients along with survivors. It reduced the main aspects of mental issues and preserved care within the patients. They found that collaborative care intervention delivered a great reduce within PTSD symptoms for along with racial and ethnic minority backgrounds. I think you have to do it. Yeah, it's okay. And then, so then what did the researchers do within like their study? So they implemented a study of people who are going to be over the age of 18 that experienced any sort of PTSD. All participants self-reported their race and ethnicity. About 635 patients participated and registered for this study. More than half identified as Hispanic or non-white, the other remaining half identified as non-Hispanic white. Patients were randomized and received care either through enhanced usual care or stepped collaborative care. Enhanced usual care is just patients received the usual care that they would receive at trauma centers with no any big change in production, just um, different cares through it. And then stepped collaborative care, they really went into the idea of getting specific with each patient. They received different interventions with consistent enhanced care, but additionally they had a lot more follow-ups along with proactive care management, cognitive behavioral therapy, and if they had the option, if they wanted to take medication. For the results for this, patients rated their symptoms 3 to about 6 and to 12 months after they experienced PTSD. Many reported after the 6 months that they saw great improvements within the stepped collaborative care. Now, collaborative care is also implemented within trauma centers now just for better and effective support for patients. So you're going to see that a lot more if you go through any trauma centers. How PTSD affects society. From an article called PTSD, The Burden to the Individual and Society by Ronald C. He has a PhD. He goes into depth on the burden of PTSD and quote from his article, it says the NCS found that the median duration of PTSD associated with worst lifetime trauma is between 3 to 5 years. It is said within the article that those who suffer PTSD can develop mental health issues. This evaluates the risk within life course and can also have health consequences later on. The cost of PTSD to society is substantial: educational, failure, teen childbearing, and marital instability are all main factors to welfare dependency. These could also just all affect society themselves along with individuals. And then these issues can keep growing in response. Many are trying to seek service in order to better themselves and for society. So interesting facts. About six out of every 100 people in the US would develop PTSD at some time in their life. Next, we have remember PTSD is not limited to just warfare and obvious traumas. It can come from family situations, relationships, emotional-based trauma, etc. So it's not limited to anything that has to do anything with society. It could be just more self. Next, not everyone will experience PTSD after a traumatic situation. The key points is that if somebody does experience PTSD, it could be that they're a newcomer to trauma. They're not really known to experience trauma, rather than for those who maybe have experienced traumatic events. Sometimes they don't have the symptoms either, just because they're maybe used to traumas or they know how to cope with it and find any resolutions to help them. Not only does PTSD take a toll on mental status, it can also cause physical symptoms, examples being headaches, fatigue, hypertension, and muscle tension. It's not all mentally, but it could also be physically. And also, too, most importantly, caregivers can also develop symptoms as well, especially if it's nurses, anybody who's working at trauma centers, they could develop also symptoms within the facilities, so it could be a little bit of a 50-50. And then finally, for a conclusion, post-traumatic stress disorder does not go unnoticed for those who experience traumatic events. Having knowledge about PTSD can inform us about the events that can occur with a loved one or even within ourselves. Noticing the signs and symptoms early is beneficial for those who are suffering. Many resources are available within a Google search or even a trauma center. Overall, understanding the circumstances of what someone can go through and gaining information about PTSD can give us the opportunity to show support. And if you didn't know, June is PTSD Awareness Month.
And those are our reference,
Okay,
and that concludes it.
yes, perfect. Thank you.